Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my 57-year-old dad has been in intensive care with cardiomyopathy and pneumonia for 5 weeks. He's still in an induced coma and he still doesn't have a tracheostomy. Please help. Part 1. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is: my 57-year-old dad has been in intensive care with cardiomyopathy and pneumonia for 5 weeks. He's still in an induced coma and still doesn't have a tracheostomy. Help. Part 2. This series of questions from Gary are excerpts from numerous one-on-one phone and email counseling and consulting sessions with me over a 2-month period. Gary and his family went through many challenges while his dad was in intensive care, and I felt very privileged helping Gary through this difficult time in his and his dad's life. So, Gary writes: Hi Patrick. After our last phone call on Friday, I've gotten back to the ICU doctors and demanded a tracheostomy. Thank you for explaining to me in detail that they have misled me, and most of all my dad, that it was inappropriate to not have my dad get a tracheostomy for nearly 5 weeks. I've pretty much explained all to them what you and I discussed on our last call, that he needs the tracheostomy ASAP and that he needs to get out of the induced coma as soon as possible. At first they were telling me that they can't do it and that they have to call in a specialist from another hospital and that it couldn't be done before mid next week. But after me mentioning that I'd be looking to transfer my dad to another hospital, they've done the tracheostomy on Sunday, mid-afternoon. All went well with no complications. However, he's still heavily sedated. For the past few days he has been having unstable episodes with his heart, so they had to increase the inotropes, mainly the dobutamine, in order to stabilize him. I asked about reducing the sedation, and they have said that they tried after the tracheostomy but that he wasn't triggering the ventilator and he was becoming agitated, so they had to re-sedate him. They're planning to start reducing the sedation again tomorrow. So here are my most burning questions for now. What should I accept? What should I accept to happen from this point forward, now that he has a tracheostomy done? Is it right to keep him sedated still at this point? They had mentioned that his heart has decreased in size, yet he's still having unstable episode. Why could that be? How long could this go on for? For example, how long can he remain on the ventilator with a tracheostomy? He still has a build-up of fluids and edemas. How could this be treated? His liver, while not majorly affected, is still showing some signs of being affected. Presumably this is all due to the cardiomyopathy, as you said before, and there isn't anything we can do to treat that other than treat the cardiomyopathy. What other questions should I now be asking? That's all for now from Gary. So here's my response. Hi Gary. Well done for putting things into practice so quickly. The best work we can do for our clients is when they follow our advice and put our advice into practice. It also shows that our advice works and delivers results. It's just a matter of pushing back on them and not take no for an answer. The best advice that I can give someone in a situation like yours is to be difficult and demanding. I still have huge concerns that your dad is in a 3-bed intensive care unit, and again, leaving your dad in an induced coma for nearly 5 weeks without even explaining to you why he needs a tracheostomy screams negligence to me. They just don't have the experience that a bigger intensive care unit has, because your dad's situation is way too complex and complicated to be looked after in such a small ICU. But I will come to that later in more detail. First, let's look at your questions in detail. So they've done the tracheostomy on Sunday mid-afternoon. All went okay with no complication. However, he's still heavily sedated. For the past few days he has been having unstable episodes with his heart. So they had to increase the inotropes and dobutamine in order to stabilize him. So here are my answers to that question. So you should ask, how are they going to reduce the dobutamine and what's their plan? If he had unstable episodes of the heart, it's most likely that he had ventricular tachycardia, SVT, atrial fibrillation are the main ones, and they can be life-threatening, and they are treatable with either adenosine or amiodarone, and that's quite common in cardiomyopathy. They also need to monitor potassium and magnesium levels, and they need to replace those when low, as it can contribute to unstable episodes. Now your next question was that you asked about reducing the sedation, and they have said that they tried after the tracheostomy but that he wasn't triggering the ventilator and he was becoming agitated, so that they had to resedate him. And you also said that they're planning to start reducing the sedation again tomorrow. So here's my response to that. They will most likely need a few attempts to get your dad out of the induced coma. He'll be withdrawing from all the sedatives, especially after nearly 5 weeks in an induced coma. They will most likely need to use some medications like haloperidol, maybe some Seroquel or clonidine to support getting him out of the induced coma. He will be withdrawing from the midazolam or Verse he has been having, and he will also be withdrawing from the opiates and the pain relief such as morphine or fentanyl. As we discussed before, Gary, 5 weeks in an induced coma to be able to tolerate the breathing tube whilst getting all those powerful and addictive medications such as midazolam or Verse and morphine or fentanyl screams negligence to me. The minute they realize that they're dealing with such a complex situation, they should have A. referred him to another more specialized intensive care unit, and B. done a tracheostomy early on to get him out of the induced coma and minimize the amount of sedation and opiates he's getting, especially in view of a severely weakened heart with cardiomyopathy. Once he's out of the coma, your dad will most likely go into a state what's being referred to as ICU psychosis or ICU delirium. Again, the longer critically ill patients are kept in an induced coma, the higher the likelihood of developing ICU psychosis or ICU delirium from a prolonged induced coma. It's nothing your dad or any other critically ill patient in intensive care needs. That's why it's so important to get patients out of an induced coma as quickly as possible, and a tracheostomy can help facilitate that. So, and here's what's next, Gary. So you're asking, what should you accept to happen from this point forward now that he has a tracheostomy? So the next thing that needs to happen, Gary, is your dad needs to get out of the coma as soon as possible. He needs some physiotherapy, especially physiotherapy of the chest, to support your dad to get off the ventilator. My concern is that in a 3-bed ICU they don't have the experience and the skills to wean somebody off the ventilator. Next, they need to potentially try and start some weaning trials off the ventilator, but it all depends on how effective they can treat the cardiomyopathy and the pneumonia. You're also asking, is it right to keep him sedated still at this point? From my perspective, not really, but they will have to wake him up slowly, as he will be withdrawing from the sedatives and the opiates, as I mentioned before. Now, you mentioned that he had unstable episodes with his heart. Again, this could be part of the cardiomyopathy, but it doesn't help that after 5 weeks induced coma, your dad is most likely having difficulties waking up. Your dad's having difficulties in waking up after the induced coma for the reasons that I mentioned before. Now, they had mentioned that his heart has decreased in size, yet he's still having unstable episodes. Why might that be? Well, his heart has decreased in size due to the dobutamine and giving diuretics such as Lasix or furosemide to increase urine output. Normally, in cardiomyopathy, the heart increases in size due to the dilatation of the heart because of its reduced ability to pump blood. And I actually put an image below this video in the written version of the blog of a heart with cardiomyopathy and a healthy heart, so you can see the difference when it pumps. Now, this also increases the risk for a stroke, as there's a higher chance for a thrombus to develop. Thrombus is a blood clot. I understand your dad is on heparin, therefore at least they are covering or minimizing the risk for a stroke. The unstable episodes are most likely a result of the cardiomyopathy. Cardiomyopathy just leaves the heart vulnerable for irregular heart rhythms, also known as arrhythmias. It's also why they are most likely at their wits' end already, and I'll come to that in a moment. So, Gary, how long could this go on for, you asking, and how long can he remain on the ventilator with a tracheostomy? The short answer is for many weeks or months, especially with such a prolonged induced coma weakening him. Also, with early treatment for cardiomyopathy such as ECMO or ventricular assist device or even a heart transplant, he could have had a tracheostomy and out of the induced coma early on. Again, I will explain treatment for cardiomyopathy on our next call. For now, you might want to check out an article about tracheostomy and weaning off the ventilator in intensive care. How long can it take? Again, I put a link to this article and the video below this video in the written version of this blog. Next, you're saying, Gary, that he still has build-up of fluids and edema. How can this be treated? Well, edema and fluid buildup can be treated mainly with medications such as diuretics such as furosemide, Lasix or spironolactone to increase urine output. It can also be treated with getting your dad on a dialysis machine. Inotropic treatment such as dobutamine or noradrenaline to increase the contractility of the heart and to increase the blood pressure to maintain adequate kidney perfusion is another option for treatment. And also replace albumin. Especially with your dad developing liver failure, there is a chance that his albumin in his blood levels are low. Low albumin levels will be causing fluid buildup as well. Now, you're also asking that his liver, while not majorly affected at the moment, is still showing some signs of being affected. Presumably this is all due to the cardiomyopathy, as you said before, and there isn't anything we can do to treat that other than to treat the cardiomyopathy. Now, here's my response to that, Gary. Liver failure is secondary to cardiomyopathy and secondary to all the sedatives he's been getting. For now, one of the next steps is to get your dad off all the sedatives and painkillers to reduce the impact on the liver and the kidneys. Low cardiac output and poor contractility of the heart with consecutive reduction in reduced liver blood flow is a main causing factor for your dad's liver to fail. The same applies to acute kidney failure in view of poor cardiac output and poor contractility and poor blood pressure. Now, I also put a link to all the questions from a client we had last year whose mum was in ICU for 4 months, that I consulted, just to give you an idea that massive challenges can be overcome with the right advice in the right environment. Again, there has been a lady in ICU, she was 58 and she was on ECMO for lung failure. And I put a link to those questions again below this video in the written version. So next, Gary, you are asking what questions should you now be asking? Well, the questions you should be asking are in view of how to treat the cardiomyopathy, as this is the underlying cause of the liver failing and the kidneys failing. We will be discussing treatment for cardiomyopathy on our next call, but my biggest concern is that they have missed the boat already by not making a referral to a more specialized and more experienced ICU who has the know-how and the equipment how to successfully treat your dad's cardiomyopathy. We'll speak again on Wednesday, and thanks again for being so proactive. Well done. Take care. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind the scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the counseling and consulting tabs. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.